Hello, everyone. My name is Terry Stigdon, and I am the director of the Indiana Department of Child Services. While I wish we could all be there together in person today, I am honored to be a part of today's conference and have the opportunity to speak to you about the important role the faith community can play in ensuring the welfare of our children. Here's a brief rundown about what we're going to discuss today. Our objectives will be to quickly review the DCS mission, vision, and value statements, to talk a little bit about COVID-19 and the Department of Child Services, the impact of neglect and abuse, and how we can partner together in a more meaningful way. So to start with, I'd like to share a little bit about myself, my background, and how I got to where I am today. So I was born in Louisiana, but moved when I was in about preschool, moved up to the Chicago area, went to a Catholic school during my early school age days up to 5th grade, and then we moved to the suburbs where I went to public school, so nice culture shock. Graduated from high school and then went to college and tried veterinary medicine for a little bit, but ended up deciding that I was going to go into nursing after I got a job working full-time as a nurse's aide in a nursing home. I really like taking care of people, and I really had no idea how much I would enjoy taking care of people, especially those in the geriatric community. As a nurse's aide, I was encouraged to go back to school and get more degrees. So I ended up getting my associate's degree in nursing, then my bachelor's degree, and then my master's degree. And I have a bachelor's in nursing from University of Indianapolis, and my master is in nursing leadership and management from Western Governors University, Indiana campus. As far as working, I worked in long-term care, like I said, and then I also worked in adult med-surg, rehab facilities where I took care of patients that were vent-dependent and needed help getting off the ventilator, and eventually made my way to Indianapolis, where I worked at Riley Hospital for 6 months shy of 20 years. I started out in the pediatric intensive care unit, and then I worked in the emergency medicine and trauma center. I ended up becoming a leader fairly early on in the ICU after being a bedside nurse for about, a year and a half. I was almost 2 years. I was able to get a management position, which terrified me and should have terrified the people that I managed. And learned a lot in those 5 years, almost 5 years that I was a manager there. Ended up going back to being a bedside nurse and going to the emergency department, and became a manager after 4 years, and then a director about 5 years after that. So in December of 2017, I got a call about interviewing or talking to some people about this position here at Department of Child Services. Not anything I had planned for or even saw coming in my future. And I think what was the most remarkable is when I was speaking to different people through the governor's office, to the governor, and to other people that are familiar with DCS, what I found was that the Lord had prepared me throughout my whole life for this position, which is really bizarre, because I think about, oh, for goodness sakes, if He prepared me all my life for this, what's next? That's where I got comfort, even throughout the fear of not really knowing child welfare. And I used the tools that He really comforted me with, and I worked through and built and developed over time in leadership. And that's how I approached my work at the Department of Child Services. So I joined DCS in January of 2018, and it has been an amazing blessing to be a part of this organization and to learn so much and realize that I really knew nothing about what the Department of Child Services does, even as an emergency nurse and working alongside the caseworkers that would come in and work with children and families. I would say that I would share with you, my faith is very important to me. I am a Christian first, and everything else falls afterwards. And so I lead in a way so that I hope that I am exemplifying my faith, and that people can see that in me and they don't have to guess. So that's what I lead with. I always ask my people to always be in the position to extend a little grace. And so I ask you today to extend a little grace as I work through this presentation. And hopefully you'll walk away from it understanding a little bit more and really seeing my heart and my love for children and families, and how the church can really be different today than it has been for a very long time. So let's go ahead and start with our mission at DCS. Just recently, actually within the last few months, we updated our mission statement at DCS because we found that it didn't really speak to exactly who we were. And while we updated the mission 2 years ago when I first came to DCS, that was a good start. But as we learn more, my mantra is, as you learn better and know better, you do better. So we made some improvements. So our mission statement is now: the Indiana Department of Child Services leads the state's response to allegations of child abuse and neglect and facilitates child support payments. We consider the needs and values of all we serve in our efforts to keep children safe while keeping families together whenever possible. So not everyone knows that the Department of Child Services also has child support under our umbrella. So it's important to make sure that we help everyone understand that there is the child welfare perspective, that the child protection services that everyone is fairly familiar with, but then there's also child support that we help to facilitate payments to make sure that children are getting the financial support that they need from both parents. Our vision and values statement, our vision didn't change too much, but we wanted to recognize that there are times that we serve children outside of Indiana, so we took Indiana outside of that statement, that children will live in safe, healthy, and supportive families and communities. And for our values had a lot of jargon in it, a lot of DCS lingo in it that's not easy to understand by the general public. And we are a public agency and we serve the public, so we need to make sure that they understand what we're talking about. And so our values are: we at the Department of Child Services empower our team in collaboration with state and local partners to make decisions in the best interest of every child in our care by embracing respect for all, racial justice, diversity and inclusion, a culture of safety, and continuous improvement. And I won't go into too much detail, but just to let you know that the culture of safety, some people ask what does that mean? And it's creating an environment where our employees feel safe to share what's going on. If they make a mistake, that they know they can speak up without fear of being terminated immediately. And that this culture of safety extends even beyond our walls as an agency, but throughout the entire system. DCS is part of a large system focused on child protection. There's the state agency that everyone knows about. We have over 200 private providers that work with families one-on-one closely. The courts are also a part of this system, I would say in a formal way. So the system is big, and it's not just the Department of Child Services, but that culture of safety needs to extend throughout all aspects of our practice and our work. And I would love for that culture of safety to extend into the public, because it is not a safe place to admit that you've made a mistake in today's culture. But we have to create that here at DCS, or we won't be able to solve any problems as they arise, and solve them before they get bigger. And then continuous improvement, like I said, once you know better, you do better, and extending a little grace. Let's learn, let's improve, and let's continue to be better for the people that we serve, internally and externally to the agency. So as I look at the impact of COVID on child welfare, don't let these statistics fool you. The current health crisis has made things challenging for everyone. And as you can see in this year, in 2020, and this is Indiana data, in March, the schools closed started closing around the 18th of the month. And then we started receiving the stay-at-home order around the last week of March. And so you see a little bit of a dip in March compared to the other 2 years. And in April, you see a bigger dip. In May, it starts to come up a little bit, even though May 2018 and 2019 were about equal. You can see May coming up a little bit from April of 2020. And then in June, you see that it's about equal. But the drastic decrease in calls were primarily because children were not in school. But I would really urge people to not fret about that, because instead of fretting, let's focus on what we did do, knowing that children not only weren't in school, but they weren't even outside. They weren't at camps. They weren't at the parks. They weren't in places where other people could see them and help them if they needed help. So this is what we did. In the month of March and through July, we increased funding to our primary prevention partners, whose primary job it is to support families to prevent children from entering the DCS system. So their role is they are paid providers of ours, and they also receive other funding from other sources, but their focus is in strengthening families, supporting the families, and getting those stressors out of the way as much as possible to create a safer environment for children. Parenting is stressful for any parent. You can't do it alone, but just compound those stressors with unemployment. People lost their jobs during the pandemic, especially early on. People couldn't work. And if they were able to work from home, then they were home all the time and really didn't get a break from their home environment. And it can be very, very stressful. Lack of money is a stressor. Lack of food is a stressor. So what are the things that these primary prevention partners can do to step in and help those parents? It was really heartwarming to me to hear from churches about how they could help during the pandemic. We had churches, along with our providers, some of them side by side, in a sense, hitting the streets with drive-through events, dropping off items on front steps to stay connected. There were churches that gave away tens of thousands of pounds of food to families to prevent hunger, just had drive-throughs available all over different parts of the state. We had community groups that we don't currently, that aren't providers of ours, but they're already in the community. They collaborated with multiple other organizations and our local offices to provide resources to families: suicide prevention, gun locks, car seats, food, fresh produce, all sorts of wonderful things to help families. To help support the parents so that they didn't have to stress about where their next meal was coming from. So that was great. I can tell you that without the faith community and the primary prevention partners in our communities, our families would have struggled immensely. And we would have seen many, many more horrible things occurring because people are isolated and alone. And it's hard to reach out to help when everything is closed. Who do you reach out to if everybody's closed? So keep in mind that the goal of the state agency is to keep children safe and promote the stability of families. So I would say that our actions during this pandemic were more reflective of that than any other time in the history of this agency, that it was on strengthening families and helping to grow the good and support the good, as opposed to waiting to punish what wasn't right, right? So as leaders in faith communities, it's helpful for you to know what are the signs of abuse and neglect. And I'm just going to cover those very generally, because the last thing I want you to feel like is that you have to be in a position where you are fully assessing children and families that you meet. But it's helpful to keep an eye out for a few things. So a few signs of abuse may include isolation. So children that tend to be isolated, or even you might see one of the parents, because we do deal with domestic violence as well. So you may see one of the parents that is kind of isolating themselves and won't really talk to others. And so that might be a sign that they need help. You might see marks and bruises on the child, or they may display inappropriate sexualized behaviors that should raise a red flag for anyone. But the key is, okay, what do you do next? And that's when you would call to try to get some help, because it could be that child is being exposed to inappropriate sexual situations that's causing their curiosity to act out in inappropriate ways. Signs of neglect could include that the parents or caregivers have substance use disorder, and that is not the only factor, because there could be other safety factors in place where that child is supported and cared for if they have one parent that has substance use disorder. But that is, I would say, it raises the antenna, so we can make sure that not only that child has what they need, but does that parent have access to help so that they can get help for their substance use disorder. If child is being left unattended, we want to make sure that children are safe, and if they are 5 years old and home alone for hours and hours, that would be neglectful. And if they appear malnourished or just don't appear to have things that they need, any resources or clothes that they need, that could be a sign of neglect. The majority of the DCS cases are neglect. Over 65% of them are for neglect. And so it's important that we address neglect whenever possible, because there's a sign that there are some stressors there to help prevent anything from getting worse. I would urge that if you see any signs, especially of neglect, that is an opportunity for the faith community to step in and potentially support a family differently. So, big picture thinking. Now, while DCS plays a critical role in the safety and well-being of Indiana's children, what we do by nature is reactionary. We are a reactionary agency, which means we step in after a child has been harmed. That is why faith-based organizations really have an important role to play. So families, when they're in need, turn to various places, including faith-based communities, particularly churches. It might be a mosque, it could be a temple. They seek out help where they believe they won't be judged. Okay, and I say it in that way intentionally, where they believe they won't be judged. So if an environment is created where all are welcome, then that parent or that family may be more likely to reach out for help. Big reasons for families being in need are unemployment, like I mentioned earlier, major illnesses, and not just COVID during the pandemic, but any illness, and not just people think of, well, they have cancer, they need help. Oh, sure. But you can have someone that has chronic lung disease that might need help because it's difficult for them to get around and get to the grocery store in time. And they may not know how to navigate the website to order food from Meijer or Walmart or Kroger and to have it delivered or anything like that. Homelessness. Homelessness is a very big issue that contributes to our involvement. If we can help provide stable housing for families and support them and get them what they need so that they don't end up on the streets, that is a major stressor that's eliminated to help keep children stable and safe. Substance use disorder is another reason for people to need help. And then just being hungry, not having food, having to decide, do I keep the lights on, do I keep the water running, or do I get peanut butter so that we can have peanut butter sandwiches or something to eat? There are families, many families, that have to make very difficult choices, and sometimes they make the best intentions to help stretch the food out, and it may still not work out for the family. So during COVID, it was really heartening when I saw the churches step in. That was amazing. We had churches creating community events, like I said before, drive-through events. One particular church out of Fishers called I-Town gave thousands of pounds of food and resources to families, and as I understand it, they were still doing it throughout the summer every Saturday to connect with the community. That's being the hands and feet, right? Being the hands and feet of the church and really being out there as representatives of Christ and saying, this is what we are supposed to do. We are to help those in need. So I thank all of you, and there are many that I know I don't know about. I thank all of you for being there and helping families who needed help. So how can we work together? It's hard for people to ask for help, especially to ask DCS for help, because they are afraid that their children are going to get taken away. There are assumptions and judgments that people don't care about their children, and that's why DCS gets involved. And I can tell you that that's not the case. They're in trouble and they need help, and they might be dealing with their own issues and haven't gotten the help that they've needed, and then their children become at risk because of that. So the judgments and the assumptions have to stop in order for us to really work well together, because we can work together to prevent children from being taken away and interrupting neglect before it becomes abuse. Remember, our goal as an agency is to keep children safe while strengthening the family. So churches can be a safe haven, and I know that that was difficult during the pandemic when churches were closed. Where could people go? And so I appreciate the churches going out to the people and understanding that if the doors are closed, where do people go? One thing all of our families have in common is that they're hurting, and another thing they have in common is that they're isolated. So make no mistake, DCS is the last resort. We are intrusive. And so what I've noticed is that we have missed opportunities along the way. So just to give you a little bit of numbers, in 2019, we had 242,478 calls to the hotline. About half of those became assessments, and out of those assessments, about 14% of them are opened as cases. So out of over 240,000 calls to the hotline of people concerned, a very small number become cases. There is a large number there in between the calls to the cases where it would help for partners in the community, for the faith community to be available to support families. Because it could be that what they have going on does not rise to the level of needing our intrusive efforts. But if someone could step in and help them, then another call doesn't come in. So if the faith community can come alongside us and be available to connect families to resources, that would be fantastic. I would be thrilled because we could really see a shift in Indiana. The other thing is churches can partner with other non-faith organizations to support families. I think it's helpful to go outside the box and figure out what other organizations out there that might be faith-based in themselves, but they may not have necessarily connected with local efforts within the community. So if everyone can kind of get together and come up with creative ideas to work together, that would really help to serve families, because the goal is to help families. Like it helps us in a sense, but the focus is really on who is it that we're serving. It's coming together to work with us and to help families. And then it would be great if churches work together. If you are with a church that has a very generous congregation that gives lots of money, and whether you're a church, temple, or mosque, it doesn't matter. If you have a very generous congregation, there are plenty of churches and places of worship in all over the state that they are struggling to keep going. And they can't help the community because they're struggling to even pay their pastor or pay their leader, their worship leader, or not their worship leader, but their faith leader. And so if churches and places of worship could work together and partner, that would help the community even more, instead of everyone working in silos. I know that would be tremendous. Keep in mind that June is National Reunification Month. And so I ask, can the faith community and places of worship help with celebrating families who have overcome hardships and are now reunited? There's a lot of celebrations about adoptions, but we actually have more families that are reunited and never come back into the DCS system again because they have gotten the help that they've needed. And I think having that support of celebrating that success would be fantastic. And who knows, that family that has reunified and has gone through some really difficult situations, they could then connect with you, your organization, or your community, and find that they aren't as alone as they once thought. So keep that in mind about how we can all work together better. These unlikely partnerships will help children and families. And that is what I'm about. That's what DCS is about. That's what we're behind. If we all work together, we can surround families in our communities with the support and resources they need. A bag of groceries can do more than you know for a family that is struggling. And sometimes the difference between a child being neglected or abused and a child staying safe is a neighbor reaching out. You can be that neighbor. Look for ways you can fill a need. It's more important than ever to keep an eye out for families that might be struggling. So let's work together to keep our children safe. Thank you.